This is Dr. Ravi Kamapali. I'm an infectious disease, wound care, and obesity medicine doctor in Georgia and practicing in LaGrange, Union Market, and Augusta also. Essentially, I do wound care along with a comprehensive approach to infectious disease and involved metabolic health and obesity medicine based service. And here is my contact information and my website. And basically, our approach is a real food as medicine approach in complex care delivery model with a target of tsunami of chronic disease as an approach to removing barriers to healing. And here is a complex case of a patient who is 79 years old, essentially having diabetes, needing surgery on the knee, replacement done on January 28, 2022, comes in with a worsening right leg pain with the blister present, and she ends up having a significant problem with 100% occlusion of the right popliteal artery, for which she was admitted on March 8th, 2022 to the hospital. Ended up with angioplasty, amazingly good outcome, with also a stent placement done in the right popliteal artery by significantly good intervention done for overall clinical improvement for limb salvage. But unfortunately, her pain continued to worsen and leg pain worsened, and a decision was made by the family because of her continued mental status change and increasing pain to undergo amputation, which was done with below knee amputation done by surgical service on March 22nd. And basically, her initial presentation was with skin necrosis and cellulitis and changes, and that warranted the intervention as I was talking about. And she ended up then also presenting back to the hospital at one point but then followed up in the vascular clinic on April 19th after staples were removed, where she had significant foul odor, and ended up we needed her to be reevaluated, and she was asked to be seen by wound care and infectious disease service. And if you see, there is this skin flap compromise and foul odor, secondary to which the debridement was done and cultures were done, and we did start wound vac therapy. And significantly, wound vac was noted to show some improvement. So a decision after discussing with surgical service was to give a trial of salvage to prevent an above knee amputation, and the family was good with that. So we continued with the wound vac, and as you see here, at a 12 o'clock position, there is this necrotic fat that was noted, and essentially that was removed. And if you see, there's an area here where a Q-tip could be probed to the bone. Obviously, as the wound was progressing, debridement, exudate management, and infection control were done along with nutrition and compression, and this helped the wound to go on and showing significant improvement. And it took us 18 weeks to salvage this limb, and she was very happy with her overall clinical care. And initially, I told her that I would dance for her, and she literally on the last day asked me to dance for her.
Ready? Go dance. Go girl. Go mama. Go mama. Go mama. Go mama. I'm so happy for you. Good.
This is when we give a hopeful, consistent, team-based approach, I think wounds heal a lot. Thank you very much. And that's what I wanted to share. An amazing case. Thank you.